Well, it's a real pleasure to be here with you all today. I think the way that we kicked off this conference really lines up well with my own thoughts. I'm sure with the thoughts of many of you as well. I know most of you come from public health or healthcare, so I view you all as colleagues today. And what I wanted to do with sort of the keynote presentation that I was so kindly offered was to give you a bit of a perspective on concerns regarding the current state of affairs for our field. And when I say our field, I mean more specifically public health and healthcare, although there are certainly a lot of shared concerns between the two fields, both sides of the same coin. And then I'm going to end with a little bit of some thoughts and some additional information about what we could do to combat some of the trends that we've all seen, that we're all living through, and perhaps what we can do as individuals and as organizations moving forward. So you can see the title of my presentation is Where We Are and What We Can Do. I kept it simple, and we're going to be about 40 minutes. I'm going to try and keep it to about 40 minutes. So I'll move fairly quickly through each slide. I don't have a lot of slides. They're mostly visual aids. And hopefully I touch on what you're feeling and your own concerns, as well as present some new information that maybe you haven't come across yet. So to kick us off, I have somebody I respect greatly, Gandalf from Lord of the Rings. And this quote I just thought was appropriate because it really does feel to me, and I know to many of us, like the tide has turned for ourselves as individuals professionally, but also for our field as a whole. And if you feel that as acutely as I do, it's because it's real. Even though we all just lived through almost 3 years of a pandemic that isn't yet over, there are other things as well, some that resulted from the pandemic and some that were already in place but have grown during the pandemic, aided by it, and the politicization of it and the intense interest on public health. Certainly more interest in what we all do and say than at any other point in my career. And I would include the HIV epidemic in that, actually, although there are certainly parallels between the two epidemics. So just to start with, where are we? Well, if you're unfamiliar with PGP, which is the organization that I run as its CEO, PGP is a public health nonprofit. And we part of what we do is pretty sophisticated media monitoring. You could also call it public health surveillance. So we've built numerous systems that track publicly available media data related to a whole host of public health topics, whether it's the opioid epidemic, domestic violence, sexual and reproductive health, tobacco control, sugar-sweetened beverages, e-cigarettes, but also vaccine confidence, and specifically misinformation and negative sentiment related to vaccines. We started this work in 2019, before the pandemic hit, of course. The reason for that was, if you can remember back to 2019, feels like 20 years ago, but we were all concerned about measles outbreaks. And good on the ground epidemiological investigations had identified misinformation as the primary source for those measles outbreaks in New York City and in LA and in Minneapolis in particular. And so we had built this system to pull in as much public media data as we could, because we were trying to get a sense of where was this misinformation coming from, what were the talking points, who was it directed to, so that we could inform and better arm public health departments and public health practitioners whose job it was to push back on this misinformation and increase vaccine confidence. Well, we didn't know it at the time, but we were a pandemic was just about to hit, and I put these two charts up just to show you the stark difference between 2019, when we were all already worried, and today. You could draw a pretty clear line without being a data scientist from 2019 to where we are now, April 2022. This isn't all information. This isn't all data related to vaccines. And this is pulling from social media as well as online websites and traditional media like television. This is actually a line that represents only explicitly negative comments, and in particular, misinformation about vaccines. You can see that there's been an exponential increase in public conversation that is directly opposed to COVID-19 vaccines, certainly, but what we're seeing is all vaccines. This is from 2019 on the left to today, and these numbers there on the bottom give you a sense of just how much we're talking about 14,000 mentions every day against vaccines across all of our media that the public is exposed to. And that amounts to about 104 billion views of this anti-vaccine rhetoric. And again, this is only a fraction of actually what's out there. We don't have access to every piece of communication data that exists. If you zoom in a little bit more, you can see that what drives these spikes in anti-vaccine communications and rhetoric and conversations are actions by public health, mostly national federal actions, but because of the sophistication of the tools, and we're not the only organization that has access to these tools, you can drill down deeper and you can look at state conversations, or in some cases, city conversations if there's enough data. And I can tell you that this is true no matter where you're filtering the data to. Actions by national public health authorities are weaponized by anti-vaccine organizations and advocates and leaders. And then at the local levels, the actions by county health departments, local health departments, state health departments are also weaponized. And what I mean by weaponized is they are turned into talking points. They're turned into media collateral. And then distributed very carefully, very strategically through a global network that has grown also exponentially since 2019 to every corner of our communities, every corner of the United States where public health is meant to serve. It's extremely concerning to myself and those of us who work in this space. You've all heard about misinformation, of course, driven by the pandemic, this new infodemic, coined by WHO, and this new branch of public health called infodemiology, which we're all still figuring it out as we go. But I just wanted to show these two graphs because I think it's a if you haven't seen these before, it can be a stark reminder of just how bad it really is out there. Misinformation about vaccines finds you, even if you're not looking for it, despite all of the work being done by technology and social media companies and public health. We are in many ways still paddling upstream. And this certainly the report by the Surgeon General and all the other efforts that have been undertaken are important and highly valuable, but we are not out of the woods. And I'll go into a little bit more detail about things we've all seen and try and provide some additional context there too. The politicization of public health, we've all seen it. It's driving much of this. What has not been covered all that well by the media, and the effects of which are not all that well understood by anybody, including those of us in public health, are the results of this narrative driven by this emergence of and growth of populism. And what I mean by that is anti-science, anti-government rhetoric that's shot through the roof, driven certainly by the pandemic, as well as a very real grassroots movement to discredit public health, government, and more broadly science. Preemption by states has increased significantly during the pandemic. If you're unfamiliar with that term, it's a legal term. And what it means is governor's offices or state legislators passing laws or making new rules that limit the power of public health within their state. Today, over half of US states, driven by the pandemic, by what we've all lived through these last 3 years, have enacted new rules to limit the ability of public health to do what it does. I think regardless of which side of the aisle you're on, this should be deeply concerning to you, because what it means is that state and territorial epidemiologists, county public health directors, the people who are essential at enacting public health policy, no matter where they are, can now not do their jobs anywhere near as effectively as they could in the past. And in the past being 2019, we already had huge problems with public health's ability to really enact the change that we all knew needed to be enacted, where the science brought us. This is a trend that is not slowing down. In the next legislative cycle, we will see more preemption passed in the states where it has not passed already, and we will see more curbs on public health power in the states where it has already begun. We need to mobilize against this, and we need to be looking very seriously at the future of our field, because this is occurring largely outside of the public eye, and it's not being covered by the news or the sources in our own field that we turn to for information about our field, as well as it should be, like I said. We've also seen a huge increase in anti-vaccine legislation by states. So last year, in the last cycle, we saw over 100 anti-vaccine laws proposed. Not all of them passed, but a large number did. And what you see in the chatter of anti-vaccine advocates and the messages that have been co-opted largely by the Republican Party is that this is going to continue. This is now a tactic. It's now part of the party platform in local elections, as well as in national federal elections. What this is the downstream impact of a rhetoric that has turned entirely against our field and against science in general. Of course, the result is that final arrow at the far right of the slide, which is trust in public health and our power to be able to do anything. I think it's important to note that when I was doing my master's in public health years ago, one of my favorite professors was a lawyer, and a lawyer who was an expert in public health law and public health policy. And I was reflecting on the semester of seminars that I sat through in that class. And one of the reflections that I was struck with was most of what I learned is actually irrelevant today. All of the things that I learned about what public health can and can't do, particularly in large-scale public health emergencies, is no longer true. It's either been trimmed back significantly or removed entirely in many state contexts. And we all saw what the use of the carefully thought through plans for pandemic response amounted to in the Trump administration. No plan at all. The effect on our workforce is really disheartening. I know I feel it, and I know that many of you feel it as well, and it was alluded to earlier at the kickoff of today. But this is a report put out by de Beaumont Foundation. They surveyed about 45,000 public health practitioners from 2021 until 2022. And you can see here some of the results. More than half of public health professionals are exhibiting at least one symptom of PTSD. As someone who lived with PTSD after returning from a particularly difficult stint in the Peace Corps many years ago, I know what it feels like, and I know the impact that has on your ability to, in your personal life and in your professional life. I've since recovered with the thanks of great mental health counseling, but I am concerned about the long-term effects on all of us, all of the people who are experiencing these symptoms. We already know that many of us are experiencing bullying, threats, and harassment. And we already, of course, know that about a third of us are considering leaving the field entirely. These are deeply concerning numbers. And then on the other flip side of it, it's not really the flip side, but the cause, de Beaumont also performs surveys of other fields. And what they found is trust among the American public for different aspects of public health is very low, as you can see on the graph on the right. They've also interviewed business leaders. And by and large, the majority of executives within business don't see a point for public health. They don't see any need to consult with public health, and they are uninterested in following any guidance from public health. This is partly due to the business sector, the industry in general, being left on its own during the beginning of the pandemic. No guidance was given to small, medium, or large businesses on what to do. And so businesses had to figure it out on their own. Now, 3 years in, business leaders are thinking to themselves, well, I did all this on my own. Why would I listen to you now? You know, what have you done for me lately? This isn't going to go away either, and it's something we're going to have to contend with. These are now generational problems, I would argue. There's no quick fix to any of these, which of course is why we're having the conversations that we're having today. So when I think about what we can do, I am, like I said, very concerned. I don't believe I'm Chicken Little, but I don't believe the sky has fallen on our heads quite yet. Public health as a field has been through some very trying times in the past, and it contains a lot of very smart, very passionate people rooted in their communities who are doing it for the right reasons. I think now what we're in need of is a circling of the wagons and figuring out what we can do as individuals, but also what our particular organization and the strengths and weaknesses of that organization is capable of doing. No organization can fight back on all of the fronts that the field is being attacked on. But every organization can do something, and every individual can do something. When I was living in Atlanta, I got to know Killer Mike a little bit, and I was left with a lot of appreciation and respect and admiration for him. If you're not familiar with Killer Mike, I'd suggest you look him up. He became famous as a hip hop artist, as a rapper. He's since become a civil rights leader, a thought leader, an intellectual, a public intellectual. And a lot of what he says about the needs in the civil rights movement, particularly around voting rights, and particularly in Georgia, pertain to the situation that we find ourselves in public health. And I think that there's a direct line between the civil rights movement, the continuing civil rights movement, and the needs to push back against voter rights suppressions, and the cause of public health. I always keep in mind that most of the communities that public health is meant to serve are communities that have been historically marginalized. Much of the great work that is to be done in public health is in communities of color. And I think that there's, for that reason, a lot of reasons to pay attention to thought leaders within those communities. So he's one of the thought leaders that I look to often for ideas and inspiration. If we're looking for that inspiration for what specifically we can do, and this relates to combating misinformation in particular, I think there's 2 or 3 things that right up at the top. There's certainly more, and it wouldn't be hard to come up with a longer list. But off the top of my head, one thing I would love to see is national and state credentialing bodies and professional associations stepping up a lot more. I'm not saying this is easy, and I'm not saying it isn't scary, and I'm not saying that there aren't good reasons why some of these organizations haven't to date, but we're past the time where we need it to happen. We need physicians who spread misinformation deliberately to have their licenses revoked. And we need public health professionals who do the same to be publicly censured and removed from the organizations that they use to give themselves credibility. I can tell you that this is happening much more than is covered by the media. We see all of these individuals and some of these organizations in our data every single day. And they are part of a highly coordinated, very well-funded movement, in many ways a political movement, to discredit the very fields that they claim to be members of. And they will continue to get away with it, and they will continue to be given large stages unless the professional bodies that represent them, represent the field that they claim to be members of, step up much more significantly than they have in the past. We are seeing this a little bit. We have seen some state medical boards. We have seen some public health associations publicly censure individuals, but it is a very small fraction of what needs to occur. And in another survey by de Beaumont Foundation, they found that 91% of Americans surveyed wanted this action to occur. If a physician deliberately spreads misinformation, they wanted that physician to face repercussions. The same, of course, could be true of public health professionals. But so far, our associations and our credentialing bodies have been very tame, very worried to step into that fray. My argument is it is past time, and I think a lot of you today would probably agree with me. There's nothing more frustrating than when I see someone with the same letters after their name as myself get up and spread deliberate falsehoods for profit, politics, and power. Another step that we can take as a community, as a public health community, is to support our state and local health departments in creating misinformation teams. I mentioned this earlier, but there is a new field of public health called infodemiology. It was really begun by the World Health Organization shortly after the pandemic was formally declared a pandemic, but it has since become a real movement, a real field of study within our field, within public health. There are universities stepping up certification programs in infodemiology. There are foreign governments promoting infodemiology and trying to channel public health professionals into them. But it is a untested and unformed field at the moment. Within the United States, we have multiple state health departments, New York and California being two of the most prominent ones, that have actually created standing permanent teams cobbled together from existing public health professionals already working at the state health department into misinformation teams. They're using off-the-shelf software solutions to identify misinformation. They're working closely with comms teams to push back, to inform the public, to pre-bunk misinformation and debunk it when it's already circulating in communities. But there are no standards and norms yet. There is no body that represents infodemiology in the United States. CDC has waded into it and releases a great bi-weekly report that you can see there on the bottom right of my screen. It's called the COVID-19 State of Vaccine Confidence Insights Report. It uses Project Vector, among other sources, the tool that PGP manages that I mentioned earlier. And there are other great initiatives. Anyone on this call who works in public health or healthcare can join Project Vector. It's a free service. You have to submit an application. Usually we turn that around really quickly, and then you can log in and explore all the data yourself. UNICEF runs the Vaccination Demand Observatory, which PGP plays a role in. That helps every country office in the UN respond to misinformation in that country. We have the Public Health Communications Collaborative, which some of you probably already are aware of. That's a newsletter that goes out with highlights of misinformation and fact checking. There's a great organization hosted at Brown University called First Draft. It's really the leader in training on how to combat misinformation, how to identify it, how to track it, what to do about it. I highly recommend them. Stanford Internet Observatory has some fantastic researchers, probably the best in the United States, around misinformation and propaganda. Renee DiResta runs that group, and she's a fantastic thought leader in this space. So there's a lot going on, but it is still being formed. We are very much building the plane while we are flying it. And there is a lot more to do. And I would love to see individuals in our field, those of us in health communications and health promotion and community health and epidemiology, really support these efforts and these initiatives and get much more involved in creating the standards and norms that will guide this practice in future. We really need the help. I can tell you that as someone who is an expert in misinformation in public health, I know everyone else who works in the space seriously. And that means there are not enough of us. So we need a lot more of you. The last step here is join groups that are pushing back. And if you don't find one that you like, make your own. Encourage your organization to start one yourself. we need to get involved much more than we already are. And I realize that is asking a lot, and not everybody can do it, and that is fine. I understand that. I also know that, like myself, many of you went through your public health training at a time where you were instructed by your trainers, by people you looked up to, by your administrators, not to get involved, to let the science speak for itself, to let a PR professional who is the comms person at your state health department be the only one who talks to reporters, who talks to the public. That ship has sailed. We are far past the point of that being acceptable any longer. Anybody with a social media account in public health had better be using that social media account on behalf of public health. Because if you're not, I would argue you're becoming part of the problem. You're allowing the problem to grow, and it is growing. We are not winning this fight. This is our shot. You can see there on the bottom of the slide on the left. That's the largest network of physicians active on social media in the United States. PGP manages that network. There's about 1,500 physicians in it. Shots Heard Around the World is a volunteer network of physicians who help each other when they come under coordinated anti-vaccine, anti-government, anti-science, conspiracy, white nationalist attacks. All those groups have merged within the last couple of years. I can tell you that Shots Heard Around the World was created a couple of years ago, and it has more calls for assistance than ever before in its history. So as someone who works in an organization whose staff actually sits on the phone with physicians, with public health professionals, when they are being doxxed, when they are being attacked, when their home address is made public, when pictures of their children are circulating around on the internet, when calls for their arrest or their murder are commonplace, we see the writing on the wall. And Shots Heard Around the World was developed by physicians for physicians. There is not an equivalent effort for public health professionals, but we desperately need one. It is incumbent upon all of us when a state epidemiologist is under attack, not allowed to do their jobs, is publicly defamed, and then they leave, oftentimes under disgrace, and will never work in public health ever again. I don't see the outcry of other professionals in my field that I would expect. And we need that to happen. We need our own unions, our own movements. When you attack one of us, you need to know as the attacker that there will be thousands of voices from public health that come to that person's defense. That is not happening at the moment. And of course, it's out of the legacy of our own field. Public health was created by government to enact the rules of government, and we're organized into silos, state and local, federal. But our opponents do not operate in that way. They see the whole chessboard, not just the piece right in front of them. We need to have a much greater situational awareness in our field. And what happens in Colorado deeply impacts what happens in New Jersey. And we need to recognize that reality now. L Beacon is just an example. It's a network of average everyday people who sign up, mostly Spanish speakers, people who in the Hispanic or Latinx communities in the United States, who sign up to use whatever influence they have to push back on misinformation targeting Spanish-speaking communities, Hispanic communities. And then Stronger is a national advocacy campaign on behalf of vaccines and more broadly science. These are just examples. They don't represent every effort underway in the United States. There are more efforts that are fantastic, that are run by community-based organizations, that are networks of community-based organizations, that are networks of individuals who care about public health than ever before that I have ever seen in my career. Most of the American public is on our side. They want to see us succeed. They want to help us, but we need to allow them to do so. And there are not enough mechanisms in place right now for your average everyday person who's not a health expert to help their local health department. But I can tell you that they really want to. What we do is we stand up what we call influencer networks for state and local health departments, for cities, for federal agencies, for hospital systems. That used to be really, really hard. It used to be hard to convince your average everyday person to sign up to join one of those networks and to push out pre-approved messages on behalf of public health. That is no longer the case. We now have people knocking down our door to join those networks, eager to be given talking points, eager to use the influence that they have to help their neighbors and their communities be healthier. There are not enough actions like that out there across the US. We need many, many more options, and they need to be for every city, for every state, and across the country. There's a lot of work to do there, and the tools exist, and the experts on how to do this exist, but we haven't leveraged them to their full effect yet. So when it comes to confidence in public health, I would just say, and the data bears this out, politicization isn't going away. We use this phrase new normal far too often these days, but it is our new normal, unfortunately. And what that means is, and I think this is really unfortunate that we're here, but public health is now a field of politics. And I hate to say that because it should never have gotten to this point, but it's the reality. It doesn't mean that every single one of us needs to operate like a politician. We still need to be governed by the science and by the rules and responsibilities of our field and by our particular role. But it does mean that we need new allies. We need to start crossing the aisle, not just between Democrats and Republicans, although that desperately needs to occur. We need to go into areas of the public that we are not often seen. We need to approach unions. We need to approach civil rights organizations. We need to approach journalists, and I'm going to talk a little bit more about that in a couple seconds. We already know our community-based organizations better than anybody. We already have mapped out who reaches hard to reach populations, marginalized populations, prioritized populations in the communities that we serve. Those people and those organizations often really want to stand up for us when we are under attack. But like I mentioned before, they don't know exactly how to do that. And often they're not allowed to do that. We need to allow them to do that. We need, when a governor or when an elected official begins attacking a public health official, there needs to be a deluge of calls into the governor's office. That is not happening right now. It occurs in silence, it occurs quietly, and it's swept under the rug shortly after that person leaves their job. We really, really, really need to push back on that. And we also need to create better ties with industry. As I mentioned before, business leaders do not see the value in public health. They view us as their enemy, the threat to their bottom line. And interestingly enough, Edelman, which is a pretty renowned PR firm in the United States, ran a survey recently on who do individuals, community members turn to first for their health information about the pandemic, for what to do about COVID-19. They don't turn to the CDC, they don't turn to their state health department, they don't turn to their local health department, they don't turn to their hospital. They turn to the workplace wellness program of their employer. That means that workplace wellness programs have had to evolve dramatically over the last 3 years into something that they were not intended to become. And part of the reason for that is it's the thing that touches people in their day-to-day lives, but it's also because of the gagging that occurred to public health officials, not being able to say what they knew to be true. So we need more lobbyists, we need more community organizers, and we need more back channels. I will share with you one quick anecdote. I love the CDC. I used to work at the CDC. I hold the CDC in extremely high regard. Unlike when our National Park Service was defunded and members of the Park Service created an Instagram account and started informing the public what was going on, the same thing did not happen for public health. I was doing a lot of interviews at the height of the pandemic to reporters, trying to explain, to help them understand what was going on, as many of you I know were too. And the thing that reporters kept telling me, and these are reporters for the top publications in the United States, the New York Times, the Washington Post, Wired Magazine, you could go down the list. They kept telling me that nobody at the CDC was picking up the phone. We really need to think about who are we most loyal to. I understand that many of us on the call are career bureaucrats and we want to keep our heads down and do our jobs. We really, though, need to think about our role more broadly in society. And if no one in our organization is picking up the phone from a reporter who's trying to inform the public about what is going on, I would argue we are failing in our duty to protect and serve the public. And that that sense, that change in perspective would be a sea change for public health. And I realize that. But firmly believe we really do need to think more critically about, is there always someone who answers the phone, even when we're told that we're not supposed to? How other organizations do that is off the record remarks. We don't make a lot of off the record remarks in public health traditionally. And I think we ought to make a lot more. The second critical step moving forward is evaluation. And I know it's not the sexiest topic for many of us. I also know there's a lot of nerds like me on the in the conference today. I was an evaluation fellow at CDC. That's how much I love evaluation. But it's going to become even more important. Public health was already underfunded. Public health already didn't have enough people in it. Evaluation conferences were already the least sexy public health conference to go to. But we need new ways of showing ROI, because these attacks are going to continue. And it's so easy to make a public health official or a public health department the scapegoat for political rhetoric. It's such an easy point to win for a politician. It's a harder point to win if our evaluations are evolving with the time. And one thing that we can do, I'm not going to say it would be the easiest thing to do, but it can be done, is for state health departments to start standardizing the way that programs are evaluated. There is no one at a state health department who would argue that evaluation isn't important. But it is true that many state health departments do not have a standardized process to evaluate all of their programs. And it is also true particularly in public health communication, that marketing and advertising agencies who have no background in public health and really no role in it other than to do what they are hired to do, are often the ones who come and create evaluation protocols for behavior change campaigns and health communication campaigns. That's not their job, they're not good at it, and it needs to be back in a state health department. So there's a lot of work there to be done. And the focus can be on what is the return on investment, both in terms of short and long-term health outcomes, but also money. We need to show that we are efficient as a field, because we are. For a little bit of money, we save lives. We reduce death and disability. There are not a lot of other fields that can say that. But there are a lot of other fields that do a much better job at arguing on their behalf. And this is where our allies, and it is also where our evaluations of our own programs come into play pretty dramatically. There is always a way to evaluate, as all of you know. Even though I know that many of us on this call are tired and we are frustrated, and some of us are probably angry, and probably a lot of us are thinking about whether we want to remain in this field. I hope that you do. I hope that you remain. And I also hope that in that remaining, we don't let everything that we've lived through the last 3 years affect the passion that we show to younger people who are interested in going into our field. As much as we are exhausted, there is a new cohort of public health professional who has watched what has happened during this pandemic, and instead of looking at public health and thinking that it's irrelevant, believes that they want to join public health and change it from the inside to make it better, make it stronger, make it more efficient, more effective. Those people need to be fostered. And we need to stoke those flames, those of us who hold any position of authority whatsoever in our field. I would love it if we would spend a little bit of our time every month mentoring people who want to go into the various fields of public health. And if we help them understand what the problems are, but also what the solutions are, and we listen to them. And for those of you who are at academic institutions, you see this passion and energy every single day. I see it with our interns at PGP. I see it with the young people online who are talking about what can be done and sharing ideas. That energy is infectious. And I think if more of us saw it, we might be less inclined to feel like we needed to leave the field. And it might make us feel a little bit better about the slings and arrows that are cast at us, because we would see that these new generations coming in believe in us. and they believe in our role and the importance of our field. There's a great initiative that's starting. It's not as active yet as it will be, but 5,000 Public Health AmeriCorps volunteers are on their way, and they will be working in state and local health departments as well as in community organizations. And I'm so excited about that. I wish that had existed when I was starting out in public health 20 years ago. I've been in public health 20 years. And the only option that was available for me was to join the Peace Corps, which I don't regret. It was a wonderful experience. But how fantastic that we are going to get thousands of people bringing that energy and enthusiasm into our field. And I hope that all of us look at that and help it and foster it and grow it. And if there's a Public Health AmeriCorps volunteer in your organization, I hope that you stop by and help them and become their mentor, because they'll need it. So, and finally, just to close my presentation today, I know that many of you perhaps feel disheartened, and I feel that as well at times. But those of you who work in community health, I have noticed, are less disheartened than those of us who don't interact so often with community members and community organizations. The more grounded you are in the people that you serve, the better you feel about your role and the field in general, I have found. And so I would just say, remember who you are and why you got into this job. Remember where you came from. That often has a lot to do with why you're here. There are over 6,000 hospitals in this country. There are 50 state health departments. There are 2,800 local health departments, and there are 300 regional and district offices. That's a lot of people in public health. That's a lot of power to coordinate, to strategize, and mobilize. And I think we all see the need for it, and I really believe that we can do it. And I think that the United States and each community in the United States will be better for it, were we to do that. So I'll leave you with this quote from another person I deeply admire. I teach my children to approach the world with a grateful spirit. We don't look down on or talk down to others, and we show respect for all mankind. It is very tempting to start throwing mud when someone's throwing mud at you, but we are on the right side of this. We follow the science and we serve our communities with respect and with dignity. And you can push back without losing the respect of your community and without losing your dignity. You can still sleep well at night. So thank you very much for your time today. Don't forget to take care of yourself. And I'm looking forward to all of our other speakers. Thanks very much.